Welcome to the Dr. Shawn Tierney Podcast. My name is Shawn Tierney, and I am a neuromusculoskeletal sonologist. I treat athletes and high performers. My goal with this podcast is to help you make better decisions regarding your health, athleticism, and all aspects of life. Here, I'm both a student and a teacher. Thank you for tuning in. Hey guys, this is Dr. Shawn Tierney with Pacific Healing and Wellness in Los Alamitos, California. Today, we're going to talk about musculoskeletal ultrasound and how it can help you get better. With all my experience in treating thousands of athletes and thousands of regular people throughout, decades of treatment, I've come to realize the access that I have with musculoskeletal ultrasound that's not available with other treatments alone. So it's our desire to see the truth based on more perspectives, more data, and more experience and expertise that allows us to come to that conclusion. So if you think about ultrasound, ultrasound is a high-resolution imaging where I can look at detailed information similar to an MRI, but in real time throughout the entire body with a limitation of I can't see through bone or I can't see through air as effectively as we can with MRI or a CT or X-ray. So it's not that it's better than other things, but it's a perspective that's valuable. And that valuable perspective allows me to very thoroughly assess multiple areas of the body with relative ease and speed and effectiveness. So let's take an example of an athlete that came in recently. Well, he had been to several other doctors, a lot of regenerative medicine, a lot of advanced care, very high-profile professional athlete, unable to do a push-up on his fists, which is important for his sport. And, we had MRIs, we had a lot of different studies. So everybody, including the agents, were concerned about how is this person going to get better? They brought him to the office, and I looked at his hands, and I looked at his nerves. I looked at the nerves that go to the hands. I looked at the joints in the hands, the ligaments in the hands. And what I found was there wasn't a lot that looked wrong, which is probably why a lot of other doctors were unable to successfully resolve this issue. And this is a very important issue for this person and everybody that works with him and under him, as whether they're a coach or a agent or whatever. So when we looked at him, I realized there was nothing really obvious going on. So I started to look at the nerves. So if there was no joint problem, there's no ligament problem, I start to look at the nerves and the nerves that surround the joint. And I not only looked at the nerves in the hand, but I looked in the nerves in the wrist and the forearm and the elbow and the neck. And I came back down to the hand, recognizing that the only place that I could regenerate pain was by looking at and pushing on the nerves right over, and this is branches of the radial nerve that were right over the involved joint. So what we found was that was most likely the issue. So we went ahead and we did something we call hydrodissection. With ultrasound, I can do a few different things. I can guide a procedure to make something numb. I can guide a procedure to create space by using fluid pressure to push connective tissue apart. That's what we call hydrodissection or hydrofascial adhesion. It's the true myofascial separation or myofascial release. So we went ahead and we did that hydrodissection procedure, and the pain was relieved immediately, and the patient was able to do push-ups on his fists immediately. And we went ahead, recognizing that was the issue. We put some very effective solution in there from regenerative medicine to help that heal and not be a problem in the future. And the person was able to go to his sport within a month and win a very big event. And more importantly, within 3 days, he was back to doing his sport that he couldn't do for the last month due to pain. So we're able to solve that problem for that individual because we had more perspectives. And one of the biggest perspectives that we see with ultrasound is we can see what happens when we move. So with an MRI or a CT, it's great imaging. It's a slice of anatomy, and I can't direct the slice. Whereas with ultrasound, it's a slice of anatomy that can move throughout any part of the body. So I can literally look at the finger completely all the way, trace that nerve or that muscle, that tendon, whatever the associated thing, and I can just look directly at it. So if I look at an MRI, I can see a slice of something, but if something is on angle, I can't look directly at it. Whereas ultrasound, I can just look more directly at it. So I have the ability to have this better, more accurate perspective that happens faster. It's not like you have to go to do a scan of the finger and then like, well, the finger wasn't the problem. Let's do a scan of the wrist. Wasn't a problem. How about the elbow? Okay, that wasn't the problem. How about the neck? How about the brain? So rather than going through all these different processes, I can look very rapidly and trace problems up all the way to the neck and down in a very short order of time. And also I can, push with the probe and see what's tender. Usually if an area is tender, that's an indication that may be part of the issue. And then if I can either guide, another doctor to hydrodissect a nerve or put a little bit of local anesthetic in the area where I think the injury or the pain is coming from, whether it's a joint or a tendon or a ligament or a disc or a bone, then I can instantly say if I was right or wrong. So this constant evaluation of me or the doctors I'm working with, being able to identify if we're right or wrong is extremely valuable. So I can literally come in and say, I think your problem is in this knuckle, and I can inject the knuckle with a numbing agent, and either that pain is gone or it's still there. And if it's still there, I was wrong. And if it's gone, I was right. So I get that instant feedback thousands of times, a year on multiple different conditions. So in time, you develop this experience, which develops some expertise in our ability to make a conclusion of what's going to work for you. So luckily for that person, he was able to go back to his sport pretty quickly. Let's take a look at an example of another person. So this other person had another athlete, had some really weakness in his pec. Pec started to become less developed, and some weakness in his hand, some grip strength. So he had been to multiple different physicians, and mostly people were looking at his arm and his hand, and it became very obvious to us that there was not a lot of pathology, not a lot of findings in the arm or the hand, and not a lot of numbness or soreness or even tenderness to sonopalpation in the extremity. So we found, hey, this is most likely a nerve root. We were able to hydrodissect that nerve root, and instantly the person had his grip strength back. Also, he had some partial paralysis of skeletal muscles in his shoulder, including his pec major and his serratus anterior. That was back, so he was able to do a push-up again, and he was able to return to his sport. Doesn't mean we solve all the problems every time, but because we have a perspective that gives us a rapid feedback, we can see things a little bit more comprehensively and a little bit more rapidly. The tendency for healthcare to look at one area is a little bit of an issue, and our ability to look at multiple areas at once allows us to have a better perspective. So I remember that the key to getting to the truth is probably more perspectives and more data and more experience and expertise. So having access to that expertise, having access to that experience helps you get where you want to go. I'll give you another example of a person who needed some help. This person had headaches. So I had headaches, but not only did he have headaches, but he also had pain across the shoulder, and he also had a rapid heart rate, and he also had ringing in his ears, and he also had a blood pressure issue. And all of these things just started over the past few months. So you imagine all the different doctors you have to see for those different conditions. He's been through a lot, very frustrated, very troubled, and nobody was finding any solutions. So one of the first things we do with ultrasound is we look at the areas where the potential problems can be coming from. So in the case of a headache, we already knew that there wasn't a tumor because he'd already been tested for that. We already knew that there wasn't a stroke. He'd been tested for that. But the obvious and most common thing is probably nerve impingements. So when we did our evaluation, we found that the most tender area of a nerve, which didn't look pathologically wrong, was at C2 and then also at C1. So at C2, you have the one of the most important nerves for headache called the lesser occipital nerve. So the headaches are generally created mostly by nerve impingements of the greater occipital nerve, the lesser occipital nerve, or the least occipital nerve. So I'm constantly looking at, okay, these are the three nerves. Each of those nerves has multiple places where it can get irritated or injured, and multiple reasons for it to get irritated or injured. But I had an access to the other thing that he had, which was ringing in his ears, and also this heart rate problems, blood pressure problems, and the headache. So I putting through all those things and evaluating the neck, we did find that there was some arthritis, a little bit of swelling and hypertrophy of a joint at C2, C2-3, and the nerve there was irritated, which would be the C2 nerve root. So we were able to hydrodissect the C2 nerve root and the plexus of nerves in front of C1, which includes the vagus nerve, the sympathetic chain, or the internal carotid plexus, the facial nerve, hypoglossal and glossopharyngeal nerve, along with the spinal accessory nerve. And it became relevant that this was associated with his problem because he had pain across his shoulder, which could be potentially the spinal accessory nerve. He also had ringing in his ears, which could be the facial nerve or the vagus and internal carotid plexus, controlling blood flow to the brain. Facial nerve controlling the tone of the eardrum and the middle ear pressure. And also possibly the C2. So we were able to hydrodissect those two, that plexus of nerves at C1, the plexus of nerves at C2. And the pain was immediately relieved. The heart rate, went from 100 to 72 within a short period of time. The headache was instantly relieved. And the ringing in the ears was mildly improved, gradually improved over the next couple of weeks. So we were able to use our expertise in this case and our understanding of the anatomy, as well as our ability to use ultrasound to push on the nerves to evaluate and find a good solution. So it's all about, like I said, perspective, data, experience, and expertise led us to solve a problem that maybe the cardiologist couldn't solve, the neurologist couldn't solve, the audiologist couldn't solve. In my teaching, which one of the biggest things that I do is teach, my first goal is to open a doctor's eyes to different perspectives, different ways of looking at problems. And when we look at different ways of looking at problems, we can kind of solve more problems. And one thing that doctors don't want to do is not solve your problem. I guarantee every doctor you see, he really, really is focused on getting you better. And I think the doctors are about as more demoralized as you are when you don't get better. So when you're not getting better, nobody's happy. So how do we get everybody to win? For your case, that's adding more perspective. So when we look at things with musculoskeletal ultrasound, we may find that, hey, a hydrodissection is not going to solve your problem. A regenerative injection is not going to solve your problem. You may need to have, consultations with surgeons or cardiologists or whatever the situation is, and we make sure that happens. But it's the added perspective, the added data, the added likelihood of getting to the soul root of your problem that helps us get there. One of the big things that I really have talked about a lot is just how things are connected. So I'm going to give you an example of a really common problem that's connected, where musculoskeletal ultrasound brings an expert, combined with expertise and experience, solves complex issues. So if it happens that you have a cold or a flu, you may get extra tissue growth or adhesions in the area where you had the infection. And extra tissue growth or adhesions, whether it's from an infection or arthritis or an injury, tend to cause things to be stitched back together, which is brilliant if you have a tear in your skin or your muscle. Your immune system will actually stitch it back together and it'll close that tear and close that skin. In some situations where we have nerves that are passing through connective tissue and you start to throw a lot of webbing or stitches through that connective tissue, now the nerve can't move well. and we start to have symptoms of nerve pain, nerve dysfunction, paralysis, which is extremely common. And for the most part, not addressed in most of healthcare. So when you get a cold or a flu, it could actually lead to hip pain. Well, how would that happen? Because it's such a common issue. So if you have a cold or a flu, you tend to get inflammation underneath these muscles. There's a phrenic nerve underneath these muscles, and nerve roots C3, 4, 5 keeps the diaphragm alive. The phrenic nerve is the nerve to the diaphragm. So if that phrenic nerve is a little bit irritated, the diaphragm doesn't move evenly. Next step is your diaphragm doesn't work as evenly. Your thoracic diaphragm doesn't work as easily, so it's harder for you to breathe. But the bigger issue for most people is now there's so much torque on the area around the diaphragm at the spinal levels, 11, 12, 1, 2, that you start to get a little bit of an injury there, and you have some back pain, and some of those nerves go down over your iliac and cause hip pain. So we have this T12 pain that can, the subcostal nerve pain from T12 that goes over the back of your glute, almost looks like a sciatic nerve problem. Or it goes, L1 goes over to the side of your glute, almost looks like a lateral hip problem. Or L1 that goes to the inguinal area or your groin. Almost looks like you have some pelvic problems. So we just want to be aware of what happens. Now, once the thoracic diaphragm is off, then the pelvic diaphragm, which is your pelvis, controls your rectum, your pelvic function, your sexual function, your ability to urinate, and all those things. That nerve may be off too. And the bigger issue may be that you just have a lack of stability, or you may have symptoms in those areas. So you got a cold, and you got a nerve impingement in your neck, and now it's affecting your diaphragm. Now it's affecting your mid-back. Now it's affecting your hip and your pelvis. So if we have musculoskeletal ultrasound, you can come in and I can look at all those things within about 15 minutes and say, there's a good chance this is what it is. Let's do a diagnostic hydrodissection, and we can see if we can get your diaphragm to work right away. We can see if we can decompress those nerves going over your hip, and we can tell if that's your issue or not. Of course, in each one of those cases, we'd also be looking at, how is your hip? Is there an injury to your hip? Is there injury to your ligaments, to your hip flexors, to your lower back? And now we have a pretty full assessment almost immediately, and we have a real way to solve a problem that you probably would not have solved before. And once we get that understanding and we kind of direct some procedures to solve that, we can also direct you to do your own work on your own. The exercises are going to help you maintain a correction or even understand why this problem happened in the first place. So it's that comprehensive approach that helps us get to the bottom of your issues. And that comes with, once again, more points of view, more data, and more experience, more expertise. And we offer that expertise, that experience, the point of view, and the data to help you get through your problems as quickly as possible, as clearly as possible, and as comprehensively as possible. I always say that if you have 7 problems and we're able to fix and address 6 of them, you still have pain. So we didn't win, you didn't win, nobody wins until we solve the problem. So the idea of being a better professional, having more expertise, is the idea of understanding all different things that are associated to your problem so we can solve your problem comprehensively, completely, and get you out of trouble. So there's a win, and you're back to your life, you're back to your sport. A lot of the problems that so many people experience are not being addressed because their healthcare providers lack that experience. And musculoskeletal ultrasound can help you get better when you're stuck. What we're dealing with now in our society is what I call lost patients. I mean, nobody was able to solve your problem, and you've been to multiple providers, and you just feel lost. And it's hard. But what we offer is a way to find some truth, a better perspective, more data, and a more comprehensive understanding of your problem to get you through this problem, to get you to the other side. We're here to take care of you and be honest with you and give you a good plan and educate you with all your options so you can make a good decision. And I think the most important thing is you make the right decision for you. So we're going to help you learn and understand how to make great decisions and learn how to understand your problem in the most appropriate way possible. Look forward to hearing from people in need, and it's our great honor to help anybody in need. Once again, this is Dr. Shawn Tierney in Los Alamitos, California, with Pacific Healing and Wellness. And if you are one of those lost patients who's been to multiple clinics, multiple doctors, and haven't been able to find a resolution to your problem, with musculoskeletal ultrasound and a thorough evaluation, we can help you find a resolution to your problem. Our contact information is in the description below. Thank you.